Don't push this one this way. Better.
God, that's unreal.
Yeah.
That is crazy. That's probably like the most noticeable one today.
Yeah.
Sure.
Okay, let's do our screen again.
Great. Okay.
Just walking normal.
Okay.
Back and forth. Just good.
I'll walk like this way for you, whatever.
Feeling anything right now? Hip, knee?
No. No.
Good, coming up. Any issues there right now?
No.
Cool. Single leg squat. Good. Other side. Heard a little pop.
Yeah.
Slight instability, but pain-wise, how are you doing?
Fine.
Cool.
Yeah.
All right, try to touch your toes as far as you can. Nice. Is that tighter than usual for you?
A little bit. Yeah, I don't know. I don't think I had that much tension in the hamstring. I think even 2 days ago. So.
Yeah. Bend back as far as you can. Nice. That feel okay?
Yeah, feels good.
Nice. Arms up overhead. How are we doing there?
Feels nice. Yeah.
Snow angel. A little bit there still.
Yeah, it's in that. It's in that like hinge spot, you know.
Yeah.
Like when it reaches about this angle.
Like right there.
Right there is when I start to feel it.
Okay.
And there, and it's really bad there until it like kind of pops in out of itself. Yeah.
Yeah. Gotcha. Not fun.
No.
Reach across. How's that?
If I keep my elbow up, I feel it. If my elbow's down, I don't.
Don't. Okay. All right. Starting out here. Nice and relaxed. Don't push your foot down. Good. Feel okay?
Uh-huh.
Don't push this way. Good. And don't push this one towards this one. Good. Don't bend your knee.
I had ice cream for lunch.
That's a good one. Good. Feel okay?
Yeah, felt just a teeny bit of discomfort. I don't even know where it was, if it was up near the knee or up here on the flexor.
Huh. Okay. Gotcha. Let's try that one. Don't straighten it. Good. Okay. That okay?
Yeah. Yeah.
Same thing?
Yeah, just,
Totally fine.
Just a little bit of discomfort. Nothing bad. Nothing ultra painful.
Gotcha. How are we doing here?
Fine.
How are we doing here?
Fine.
Don't push your foot in. Good.
Oh, I felt that over here.
Yeah. There was like a little bit of weakness there too, so we'll get that in a second. Go ahead and bend this leg up though. Feeling okay right now?
Yeah, I mean, I feel a little bit of the
Tightness.
stretch here in the piriformis, yeah.
Gotcha. Don't pull your foot towards me. Okay, still there.
No, it's still there.
Yeah.
I even tried like massaging it too yesterday.
Yeah.
It's angry.
Don't pull your foot towards me. How's that?
Painful.
Painful still? Okay.
Yeah, it's like probably inflamed. I mean, honestly, when I was doing this, the side, like the lateral leg things, I've never not felt it. Does that make sense?
Yeah. Don't pull your foot down. Yeah, there could be some inflammation there. Just getting it to activate again though will help get some blood flowing through it. Don't pull your foot down. Nice. Okay, you're good there. Go and flip onto your back again. So this kind of starts the process of letting it do its job and heal. All that. Okay, moving on to the right. Don't push it down. Good. Don't push this one this way. Okay. Pain with that at all or no?
Mm-mm. Want me to ditch the belt?
No, you're fine. I didn't know where it was.
Sure.
Bony landmarks, I kind of reference.
They used to be bonier.
So did I. It happens. Don't push this one this way. Good. That okay? Don't push this one this way. Okay.
Might have been weak, but it didn't hurt.
Okay.
That makes sense.
That's good. Absolutely.
That last poke was a good one.
Don't push this one this way. Better.
God, that's unreal.
Yeah.
That is crazy. That's probably like the most noticeable one today.
Yeah, that was definitely pretty bad from the start. Don't bend your knee. That's pretty solid. That feel okay? Good. Don't bend your knee. Okay. Good.
I feel like I'm being poked way less today.
Yeah, this is a good sign. Don't bend your knee. Okay, that one though needs it. Yeah, so certain stuff, you know, it just kind of shuts down on us. Doesn't mean it's always a problem or even a part of your main issue. But typically on the second visit, a lot of the miscellaneous random muscles that are giving you part of the issue just go away. So we're just left with your piriformis and a couple other things. Don't bend your knee. Granted, the shoulders may be a different story. We'll see.
Yeah, the shoulder, I mean, it's a lower priority for what it's worth, but like it's still frustrating.
How are we doing here?
I can kind of feel it here in the, whatever this is.
Tight. Yeah.
That's just tight. Yeah, I can feel it.
Okay. And then how
That's
about
fine.
don't push your foot in? Good. Okay, and this one. I'm gonna try to turn your foot like that. Don't let me. Good. Same thing. Good. One more time. Good. How was that?
If there's a little bit of like feeling here, up here, you know, in that piriformis, but it wasn't like hard or sharp, or it was very dull.
Okay.
Kind of faint.
Gotcha. Okay. Let's just address it. Go and flip over because it is those muscles do help with the piriformis, so
Okay.
might as well make sure we can get anything out of it. These are the deep external rotators, so they're kind of like bottom of the butt here.
Do you? I trust you.
Okay, and flip over again. Don't let me don't let me turn your foot out. Good. Same thing. Good. One more time. Same feeling or no?
Yes, but even less.
Okay, good. Bend this leg up. All right, staying right there. Actually,
Oh,
right
keep this
there.
up?
Yep. Don't let me push your foot out. Okay. This one might suck a little bit.
A lot of nerves are, yeah, right around in there.
They call it, think like second grade playground, getting tasered or something. Is the phrase for it. Don't push your leg out. There we go.
It's just nuts.
Let's switch legs there.
Got it. Okay.
Don't push it out. Yeah.
Yeah, close, but no cigar. Huh?
Yeah. Don't push your leg out. Good. Okay. Good there. Moving up to the arms. Quick here. Boom. Don't pull your arm up. Good. Don't pull out to the side. Good. Feel okay? Don't push your hand to the ceiling. Good. I think we cleared the legs in less than 10 minutes, so don't push your hand to the opposite hip. We're gonna get that though. Don't pull down towards me. Any pain with those?
No.
Turn onto your left side. Just like a little bit of give on each of them.
Yeah. I mean, I do have like really loose shoulder socket situation happening. Like,
Yeah,
what did you say? Like extra flexibility or something?
Hypermobility is kind of like
The term.
term, yeah. Yeah, just based on like when you bring your arms up overhead and behind your head, that kind of indicates that. Would have been a good swimmer. Probably would be dealing with more shoulder problems if you had swam though. If you don't.
Whoa.
Nice.
There's a lot of like knotty bits in there that you
Yeah.
are pushing on. I should probably go get a massage.
No.
No?
No.
Don't get one?
The deep massage a lot of times actually shuts muscle down. Like it just fatigues it so much. Now, granted, you could probably that just like stretching, like you could stretch and it shuts it down, but an hour later it just comes back. Same idea with massage, it may take a little bit longer. So, you know, if you enjoy massages, just don't expect it to functionally improve you. Don't push to the ceiling. Okay, a little bit of help there. Any
A
pain?
little bit of discomfort.
Gotcha. Don't push your opposite hip. Okay. Yeah, there.
Definite pain there.
And then this one, don't pull down towards me. Okay, a little rough there. Yeah, turn onto your right side.
How to think about that? Right from left.
I've demonstrated this stretch thing for you, right? Where it like shuts the muscle down, right? Or have I not?
If you like static stretches,
Yeah.
I mean, I've heard you talk about it a whole bunch.
Okay.
Static stretching is no bueno. You have a video out on that, don't you?
Oh, I'm sure I do, yeah. Probably an old one on Instagram. Turn on your back. I don't have my dynamometer thing that I used on you before here, but don't push up to the ceiling. I'll show you, give you the idea. Don't push your opposite hip later or after treating you here. Don't pull down towards me. Good. Don't push your elbow down. Good. I should ask, any issues with the ones you saw?
Not really.
That you noticed, or?
Just a little bit of the discomfort when we were out here. Like,
Okay.
just
Still
even
there.
doing that, just as I
Yeah.
can feel it, you know?
Gotcha. Okay, let's check. This guy coming straight overhead. How we doing? Doesn't like that.
No, it was okay. I was anticipating. It actually wasn't terribly bad at all. Do you feel the transition when it
do.
slips in there?
Yeah.
Both my shoulders do that, for sure.
Okay.
I don't know if that's good, but like, did you hear that just now?
Yeah.
That's like where it,
Yeah. Wow. How
Every-
long- Have you been doing that for years, or
I don't know.
do you notice it when you swim?
No.
Okay. Don't push up to the ceiling. So it might be something we can fix with better muscle recruitment. So basically, motor unit recruitment, fancy words for the more resistance you have to push against, the more muscle you activate, basically. So more muscle you activate, the better, more stable the joint will be because it's just holding it tighter.
Yeah.
Does that make sense?
So I have like beefcake in my shoulders.
Kind of.
Okay.
But we do that for you. You know, some people have trouble lifting more weight. In your case, your problem is the opposite, where like general daily, like no weight stuff, things just float around. But
Yes.
if you activate better, then you get better stability out of that.
Okay.
So, I didn't poke. Got to poke. Let's try that again, see if we get anything there. Coming up. Might get the same thing. Yeah. Wow. That's crazy. Don't push to the ceiling.
Like, I don't.
Was it painful there?
That's
or
not
no?
how shoulders work. Like, you know how when we throw a baseball or a football, you're supposed to start behind your head and like throw straight.
Yeah.
I'm like always off to the angle because this hurts. I can actually like if I do that, I feel that slip
The rotation kind of thing going back
like
there.
this, like from up.
Yeah.
There's always that I have to like almost like guide it back in.
Wow. Okay. Yeah, let's see here. Don't turn your hand out. Good. Don't turn your hand out. Good. Same thing. Yeah. Okay. Not painful at all, though?
No, that was fine. Objectively way more painful for you than
Yeah,
those
just
things.
straight.
No, than just that stuff.
Yeah.
No, I'm just kidding. I'm just kidding.
Yeah, absolutely. Don't turn your hand out. Yeah, I know. So this isn't always comfortable there. Good. One more time. Okay, that was better though. Don't push your hand to the ceiling. Don't pull your arm towards me. Good. Same thing. Okay. One more time. Okay. Down. Who's in charge of band now that you're vice principal?
North Texas, like while he's doing his. Sorry.
Yeah, I was just seeing if that was that you trying to hold back or?
No, I just didn't know what I was doing.
Okay. Don't push your hand down that way. Good. Is that okay?
Yeah.
All right. Solid. There.
Actually, I don't know when you did that armpit stuff.
Uh-huh.
Like I still have discomfort in my shoulder, but like it's not the same. It's weird.
Yeah.
I don't know what you were doing.
So the armpit one and the one I just did.
Like those when you were like deep in there.
Yeah.
Like something. I mean, maybe I was just sort of feeling that still, and we've been kind of checking with it, so it's hard for me to tell. But
yeah, the armpit one, that's one of your rotator cuffs. You got 4 rotator cuffs. Right, so
for the cuff muscles, like one was like a sock, the other one's like around.
yeah,
forget.
exactly. They surround your shoulder.
Right.
So aside from rotation, they help with general stability of the joint. But usually, I mean, this one I do find a lot of problems, especially if you're throwing or swimming, because it involves a lot of that internal rotation movement.
Mm-hmm.
So basically, if you're throwing, this is, even though you're going into what's called external rotation, like turning your hand out like this guy is supposed to be controlling how stable your joint goes because you're going backwards this way. So you're just cocking up to go forwards that way. So if this guy's giving you issue, that might be part of your stability issue when you pop.
So is that like lats and stuff? Do I need to like?
I'll give you an exercise for it.
Okay.
It's more so, in your case anyway, it's more of like rotation. So it's a really simple exercise.
Okay.
Another one you can do at your desk. Hold it and lay back. All right, low abs.
Yeah, I know. Here it comes.
Last poke here. Actually, we'll do this one, then we're doing hip flexors again. So
that's the one where you kind of like go around the hip,
it's like right
the
there.
pelvis.
Yeah, there we go.
I had Lindsay do that last night. Like just dig in.
And cross your arms first. This guy here, hold it. Switch sides, hold it, and reach for those toes. Boom, nice. Lay back one more time. Okay, this guy, everybody's favorite one. Don't push your foot down. Good. Same thing. Painful?
Yeah.
Yeah, okay.
Piriformis or whatever.
So that's
or like it's just in the hip. It was just over here in general.
Yeah.
Just, I don't know what it was.
So let's get this muscle. It's a hip flexor here.
Okay.
Now deep breath in. Good. All the way out. There we go. Now I can't technically, like with my fingers, poke the psoas. I'm literally just kind of like poking your intestines into it. But as long as we get some pressure there, wake it up. Okay, relax there. We're gonna retry that. Don't push your foot down. Okay, same thing. Same pain?
Yeah.
Okay, so that's still an issue.
Definitely feels like behind me though. Like it's I don't know where it is. I feel it though in my hips somewhere. Is it like here?
Basically, it actually attaches to the front of your lower back spine.
Okay.
It comes forward kind of like through the hip here, right? So it snakes through a lot of things, so you'll probably feel it with a bunch of stuff.
Yeah, okay.
So if that's an issue, then...
Is that what this muscle is right here?
Yeah.
Is that what that is?
Quite possibly, yeah. There's a bunch of, things overlay each other, but yeah.
Sure.
Okay, go ahead and stand up and walk it off. I'm gonna give you 2 new ones today. There we go. Coming up. How are we doing there?
Fine.
Cool.
It actually felt really good.
All right. Little single leg squats there. Good. Other side. Good.
Definitely instability on the right side.
Yeah.
That's
We can
interesting.
tell that. So that's still partly the glutes that we have or working already. Touch your toes again. Okay, pretty good there. And bend back. Boom. Good. Twist each way. Good. Good. Arms up overhead. Good. And then snow angel. That was pretty solid. How'd that feel?
Like objectively better.
Cool.
I still had that transitional bit, but it didn't feel like somebody was like putting bone on bone.
Yeah, because I've been able to visually like see like at that little like jump there, and I didn't see it that time.
Yeah, it's definitely happening to a degree, but it's not as pronounced at all.
Cool.
Yeah, whatever you did in that armpit, man. Wow.
All right, reach across. Looks good. Feel okay? Mm-hmm. Cool. And behind your back.
Again, when I lift up, I feel it. Something up here.
A little bit there. Okay,
Yeah,
gotcha.
sorry.
No, you're fine. Good.
Then you sit behind me.
Yep. That
Fine.
looks fine. Good.
Fine.
All right. I'm going to grab a chair. I'll be right back.
Cool.
Good. So with that left arm, we're going to place on the table.
Okay.
So you can do this at your desk. What you're doing, you're going to try to push into the table like you're trying to do this motion. Does that make sense?
Yeah, that's it.
And you want to feel that under your armpit.
Okay. I feel it. I feel it out here.
Perfect. Yeah, a little bit of tension there. Just to hold for 5 seconds, 5 times. All right. So that's going to activate that.
There's a little bit in the back too. Is that normal?
Yeah, because the muscles are deep, you'll probably get like some referral back there.
Yeah.
Totally
Yeah,
fine.
it's fit coming up to here.
If it really starts to bother you, let me know. This one too, you can changing the angle can make it more or less comfortable.
Like this, or like,
So
or sit higher,
sit higher, so a higher desk might be easier.
or sit. Oh, I see what you.
Right. And now for your hip flexor,
Okay.
I'm going to start you off with a short lever one, again, that you can do sitting, which is literally, let me grab my stool here, and I'll show you. Very simple, but I'm going to take, in your case, your right hip, push my hand in, push up.
Just push up against my hand.
Yep.
So just
Yeah. So,
energy going this way, right here
exactly.
at the knee.
Yep. Hip is flexing, hand is stopping. Good.
So it's similar to this, but it's not the same muscles at all.
Correct. Yeah. So this is quad and hamstring.
Right.
This is hip
Flexor.
flexion. Yep.
Yeah,
Good. How are we feeling there?
it's definitely. I mean, I'm
Okay.
feeling
You-
things.
Yeah, you can alter how hard you push. We just want, like, if you feel some tension there, that's all you need, right?
Oh, so I don't need to like kill it.
Yeah, exactly.
Okay, because every time I've been doing these, I've been like killing it.
Okay. See if you, just in your case, I mean, because of the sensitivity of some of the stuff, just back off on how intense it is. Just feel the tension, and then go about activity if you can. If you're not stuck at your desk, just walk around. You know.
Yeah. So like when I do this one, this is the if I'm left, if it's behind, it's this, and pushing down is this.
Yes.
That
Yep.
makes sense because that's what I feel. I just want to
Good.
make sure I'm doing it the
Yeah.
right way.
You got it. Yep.
Right, yeah, and then
Good
this
there.
one.
Yeah, that guy.
Should I do it with the left one too, just for balance, or does it matter?
Why not? Yeah.